Welcome to our Focus Forum. I'm Rita Riker, Board President of Focus, and really delighted to see so many people in the room, as well as we have quite a few people online. So we're all looking forward to hearing a little bit today about spoken language services. So panelists today are sharing perspectives on their current challenges, emerging opportunities, and the work that occurs across Central New York to ensure language services meet the needs of our diverse population. Later this year, we'll host a forum on sign language services. So today's is related to spoken languages. We have three panelists who have generously offered to be here with us today. In alphabetical order, they are Leo Rose Andrews, Quality Assurance Coordinator for the Center for International Health at SUNY Upstate. The center serves a globally diverse patient population who find themselves resettled to Syracuse. The center's main goals are addressing health concerns, stabilizing chronic conditions, and improving health literacy. Much more about the center can be found on our website. Nawal Al-Sayed Noor is Senior Cultural Education Coordinator at Interfaith Works. In her position, Nawal supports the needs of newly arrived refugees, focusing on helping them understand U.S. systems such as housing, healthcare, employment, education, and civic responsibility. That's quite a list. This allows her to support successful refugee integration. And Lida Raganese is Supervising Director of the Multilingual and Cultural Education Department of the Syracuse City School District. This department focuses on ensuring that all English and multilingual learners acquire and develop English language proficiency to support integration into all school programs and services and enhance academic success. So, Lida, I think you're up first.
Yeah. Thank you. Hello, everyone. Thank you. So I'm Lida Raganese. I've spent over 30 years in the Syracuse School District. I was a teacher for 18 years. And then I'm a school administrator now, and doing what I love is overseeing the department that I was a part of, welcoming new Americans and Americans that have been here for a little while. Myself, my family came back in the 70s, and we were just like the students that I welcome every day. So I love Syracuse, and I've opted to stay here and enjoy the snow that it brings. So in Syracuse, we have a very diverse population of students. My department, I oversee English as a new language. So in other states, it's known as English as a second language. But in New York, we want to call it as a new language because there's always new languages that we're learning. And many of our students have know 2 or 3 languages. So there's always an opportunity to learn new language. I also oversee our bilingual programming and our Native American program and our world languages. So I'm here to focus on our English as a new language. In my office, to help with language support with our students and our families, I have 5 bilingual nationality workers. They represent the top languages in our district, and between the 5 of them, they speak 10 languages. I also, through a grant, brought in 5 additional school-based nationality workers, and they are directly at the building and situated in one of our highest populations of students. So, for example, Honegger has a huge population, over 300 students there. So we've assigned 1 nationality worker there. So on top of that, we have some bilingual staff who are part of student registration. And one of them is bilingual. They all have to be ENL teachers. So they have to have the skills and knowledge in working with multilingual families when they come in, especially those that are more limited in English. And we use, I'm sure we all have used, like there's tools that we use like Language Line, which has been really helpful. We also use talking points in our district, which is an ability to text our families. And you can get accounts that are free also. We've opted for the district account where easily we can send text messages to families what we've learned is that they may not have a computer when they first come, but somehow they do have a cell phone and they're able to text back and forth. So these are really quick messages in over 100 languages. Again, like I said, language line, we have our bilingual staff. I myself am bilingual, I'm Hmong. We don't have a large community in Syracuse, but we used to have probably over 60 families. So I jump in at the few times when we do have one of those families. At the schools, we purchase bilingual dictionaries for students to use in their content area classrooms. We also we do use a little AI, and we're very cautious with that because I always tell the principals we use Magic School, which is designed for districts, but you should always have a human vetting the information and do not translate anything that's too long. So I would be reluctant in just, having it translated in another language and then sending it home. Sometimes we only use that when we're desperate, right? And there's no other individual out there that can help us with that piece. But I'm just very nervous about that right now, but that is probably at the most cutting edge as you can be with using AI with translation. So very short phrases is what I would recommend. And we've also offered the use of a free app, the Microsoft Translator app. We've used that with our nationality workers, and they tend to, they said that the quality of that is pretty decent. So when I started back in the 90s, we really only had a handful of bilingual staff that we would use from our adult ed program, which is the refugee assistance program. And as a teacher, you did struggle. We didn't have the tools that we have now. But what I've tried to do in the district is not have that be an excuse anymore that I can't communicate with students and families because of all the tools that we have. There's many ways that we can communicate with them. Some of the challenges is affordability, with all these tools that we have, some of them are not free. And especially with like tools like Language Line, like every word that's translated, it costs, so many cents. So we know that it's the law that we need to have it in languages for our families so they can understand and be a part of the education system that their child is spending most of their days at. But that is a struggle, I think, not only for Syracuse, but for many, many districts. I have colleagues in Buffalo and Rochester, and they are experiencing the same things. So if anyone out there that is can develop something that is affordable and quick translations, we would love that. The school districts are looking for that. Other challenges is sometimes we go back, we resort to whoever is available to help us with translations, but I do heavily encourage all the staff in the district, do not use students with the translations and interpretations. We need to have adults that we vetted and trained through our office before we can use them. And then there comes to issues when, there are some things that are private that you do not want to have a student to assist. And another piece is just like I said, like the cost. So I think that's the biggest hurdle for the school districts. There are tools out there, but it's the affordability piece. But we know it's a priority. And I just had a meeting last week and I've gone to the budget department and other departments in Syracuse, just letting them know that this is something that the families deserve, the students deserve, and we need to give our students access to everything that all the other students have, but they need to understand it. Another big piece is just our low incident languages, the languages where there's only one or two students and we can't find anyone in the community that speaks that language. So a few of the examples as I've written it down here is Basa, Malay, Javanese, Oromo. I looked at our data this week and like one student speaks, each of these languages. And if we have an issue, like I don't know, probably Language Line, but if they don't have it, then it'd just be be very tough. So that's one of the biggest issues that we have. And another thing is that, we have all the teachers that we've trained, all the administrators that we've trained, but then they retire and then we get new ones, which is great that they want to work in Syracuse, but that training that needs to happen on how to work with interpreters, even calling up like a tool like Language Line, how to do it so that, you're not talking in long phrases, that you stop at different points so that the interpreter can interpret the information correctly before you move on. So there's always a need to make sure that the staff, from the superintendent down to myself, my staff, our bus drivers, our custodians at the school, our phys ed teachers, anyone, when you come into contact with these students and families, these are all things to keep in mind. So at this time, I'm going to pass this along.
Good afternoon, everyone. My name is Nawal Sayed Noor. I'm Cultural Orientation Senior Coordinator at Interfaith Works.
You hold the mic.
Okay, it is truly to be here today, and it's an honor for me and to be part of this important conversation about the language service and supporting diverse community. In my role at Interfaith Works, it is about I work closely for new American since when they arrived to United States until they became independent. So I conduct cultural orientation for them, just to make them understand the system here in the new community. We did only for 25, we did 42 classes for them with 10 topics and 7 multi-language. This is only in 25. We just make them understand the system regarding to the healthcare, education, transportation, and even housing. We just explain them the document they should know more information about it. And what make my work it's especially meaning is my dedication to help and professional background. I am originally from Iraq. I've been experienced with 15 years. I worked as an interpreter and linguist for government sector as Ministry of Education, Foreign Affairs and Defense, and for the private sector, and as well as with international organizations like NATO, British Council, as well as UNESCO. And all this experience exposed me and diverse culture and linguist professional to be more accurate and understand the culture context. Language is one of most significant to all new Americans. Many arrive with limited English or no English. So this is what make our tax it's overwhelming, because they feel that they didn't understand anything. They feel they have like struggle and challenge to understand the new community. So our roles at Interfaith Work to help them to understand this system by supporting them, by provide language service for them, and this is make them more trust and confidence with respect. And starting over the new country for them, because I have some experience, I was a refugee myself, so I have all this experience. I face all this experience. I know their struggle, their challenges, their fear, their unsafe. But as once they arrive to the airport and they see someone who speaks their language, all this fear is gone. Just explain them and just talk them about my experience that I can, like Samuel, it is take 3 months, 6 up to 1 year to understand all this new system for you. I'm just trying to make them like calm down. This is okay. You are not only family who feel weird or feel trauma or feel anything. This is normal. It's happening for all the new refugees. So we're trying to make a trust, build a trust with them, and give them the more information about how they rebuild their new life here by giving them the information, providing the interpreter in their language, and make them understand all the life here to be an active member and individual in our community. And the language access is not only communication, it is dignity, equity, responsibility, and communication. It is not about only words. You should have the cultural context to make them understand what's happened. It is not about the word by word. We can use the Google Translate, but it doesn't make sense for them. We should at first know the cultural context to understand what's that meaning behind all that new things around them. And finally, for me, it is not only a job. It is passion, it is mission, it is responsibility. And I'm so grateful for Interfaith Works, who really give me this opportunity to support the refugee as they are supporting me. Thank you.
Thank you guys. It was really, I'm honored to be at this table, these lovely women. They've done so much incredible work. So thank you for inviting me. So my name is Leo. Just a little bit about my background. I started working in refugee services in 2011 after I left undergrad. So basically my entire career has been in refugee services. So I started working at CYO, and have done everything from youth coordination to like direct service youth programs to RMP resettlement. So the first 90 days, the youth coordination was registering students for school, helping liaison between the schools and the families, intensive case management as well. And that work had brought me into the realm of public health. So through that experience and all the work that I've done, I want to echo Noel saying about the cultural humility. Like, we're talking a lot about languages and the use of translators and the words and how to get words across. But in the work that I've done, the way that this work has changed from work into passion into a lifestyle is that it's about living in community with people and kind of coming to understand each other. So in whatever job I'm doing, whatever thing I'm doing in my life, whether it's eating dinner or, doing helping a patient get their medications right, for example, we are bringing ourselves to a place where we want to understand each other. I don't just need to be understood. I need to understand each other. So it's been such a blessing to learn from a lot of folks, and the folks that I learned from the most are the people who come from the different places that I've come from. People have welcomed me into their houses, given me space to talk about my culture, shared different types of cultures, because I do come from a multilingual family, although sadly they did not teach me the language. They just talked it all around me, which was really great. But blessings. But I've been blessed that I've been able to learn more languages along the way. So I had worked at CYO, also spent some time abroad, living in Morocco and Casablanca, working in a small NGO there. So I had some experience around being in an entire different place where everything is in a different language. So they speak Darija and French. And it was so exciting to be able to pull different languages, and I had some of my Arabic from working in the community. And again, it's more than just like when I took the time to learn people's languages and learn people's cultures, it created like a warmth and a bond that really is so much deeper than I go to work, I do my job, and I go home. So I've created a lot of really incredible friendships and have deeply enriched my life to be able to share cultures and different ways of living, because this is a global community. Syracuse is a very unique space. I'm not from Syracuse originally, but I moved here and came and found that, I don't have to travel the globe. I get to go to my neighbor's house and share different food, different cultures, different languages. And it's all right here. And historically, Syracuse has been a place that has welcomed immigrants and refugees throughout its own history and throughout the history of refugee resettlement in particular. So Syracuse has been one of the most successful refugee resettlement cities in the nation, and especially in New York. We get a third of the refugees in New York. And our resettlement agencies are really that core and basis of how we serve that community. So currently I'm working at CIH, and my path has brought me to that space because I was blessed enough to have a mentor who showed me how public health could create sustainable change in our community. If somebody is healthy, they really can do almost anything, right? It's the baseline. There's a lot of social determinants of health, of course, that affect your ability to be sustainable and successful. But to me, that was that natural next step from social work direct service to improving our health system so that folks can become healthy and be able to access health in an equitable way. So I work at Center for International Health with Dr. Andrea Shaw, who was kind of the driving force behind what we do. And she's been, an incredible person to work with. It has been the hardest worker in the room, right? It's a surprise to have a director who's there later than everybody else and earlier than everybody else, and is making her own phone calls, speaking to people directly. She's really an example of what it means to reach out to the community and be part of the community. And so our clinic serves 39 languages and people from 55 different countries. Our model of care is really based around creating scaffolding for folks. So we get the most medically complex folks in the community that are settled here. And we want to make sure that we're getting their acute conditions taken care of, while also getting their chronic conditions under control, and doing that without the proper cultural context and languages is really difficult, right? If you're giving somebody a bunch of medications, I really give it to my pharmacist. I have an incredible pharmacist, MJ, that does a lot of work to create systems of medication distribution. For example, they have dispo packs where they put your daily medications in little bubble packs. She puts little moons and suns on them and works with all the community liaisons we have in our clinic to really explain how people's medications work. Because, every time you get a new medication, maybe this month it'll look like that. Next month it looks a little different because you got the generic brand, and you don't know exactly what time you're going to take it. And that could cause a lot of really, really horrible health implications, especially for folks who have chronic diseases. And the folks with the chronic diseases are often the most vulnerable and are having the hardest time accessing care and understanding their care. When it comes to our work, we have to understand that it's not just health literacy. This word health literacy gets thrown around a lot as if somebody is health illiterate, but maybe it's just incongruent. Maybe they're from a different congruent health system. Maybe they have different ideas of what health means. So we are blessed enough to have 4 full-time interpreters that are in part of our crew. And they're much more than just word interpreters, right? They're our cultural liaisons. They help us to understand the context that people are coming from and the health systems that people are coming from to be able to serve them better and help them to get their idea of what the best picture of health is. We really want to help people reach their goals, not just tell them what to do. Because often, I've heard from different healthcare providers, especially as being an intensive case manager, that people are medically non-compliant, right? They're not showing up to their appointments. They're not taking their medications. They're not doing the exercise that I asked them to do when they're not looking at the entire picture. So we're blessed enough to have folks in our not just interpreters, but also staff members. There are a lot of our staff that come from the community, speak the languages, came as refugees, came as immigrants. And as we become and grow and become more popular and get more positions, we get more folks coming in. And I'm getting students that I had when I was, back in 2011, 12, 13, and that are now going to come work at our clinic. And that's like, the moments, right? The full circle moments when you see students who came here and spoke no languages, and now they're coming and they're helping their community, advocating for the community, being that example for our patients that are coming in. So it's just such a beautiful, beautiful thing to be a part of. And so when it comes to healthcare, we want that cultural context. We strive to have all staff members that understand and have cultural humility. So again, it's not just I know every culture, but it's that I don't know what your culture is, or I don't know where you're coming from. So being open-minded and understanding that if somebody doesn't want to do something, or somebody is maybe misunderstanding you, it's not just because they don't want to, or they're not trying. Maybe they're tired today, maybe they're fasting today. You never know, right? So that's how we work really hard to create that scaffolding and health equity. We also work really closely with our community partners. So we have part of my job as a quality assurance coordinator is that I do stakeholder engagement. So meeting with our community partners, we do community health worker programs. We have clinics over at CYO where we do screens, so blood sugars and blood pressures, to try to catch folks who haven't been to their PCP in a while, and get them where they need to be if they need urgent care. And having those partnerships, again, has enhanced our patient care and enhanced our patient understanding, and built that trust. So that's the last piece too, not the last piece. There's many pieces, right? But that trust. So if we have people that look like our patients in the room, that are advocating for folks, that are looking in the eye, that are caring for you and trying to hear where you're coming from, our patients come to trust us much more. And we've been able to grow our clinic more, have more health navigators and care coordinators, again, from the community, that can really deal with those social determinants of health as those are brought up in the clinical spaces. So that builds the trust, the accessibility, increases your medication adherence, your medical intervention adherence, and ultimately the big goal is creating health equity. So it's more than language, it's that context. But again, I really appreciate to be here, and yep, that's all I got.
Thank you all. So we received a few questions ahead of time, and I'm going to try to, some of them I don't even understand, but we'll give this a try here. Let's start with Lita. Do you collaborate, and to what extent, with the Syracuse City School District adult education? Do you do any collaboration with them? How does that work?
Well, since we're both programs in the Syracuse School District, we have to collaborate. Just probably a week and a half ago, we had, within a 2-week span, we had parent sessions where we invited the parents to come over. We moved I had an option to move my office anywhere, and I begged to be on the north side where we're close to our families and students. And so the Refugee Assistance Program is really right in my backyard. And so we had parent sessions where they walked away. It was under the household safety forum, but they walked away with a laundry basket, mops and brooms, and just pots and pans where, we have our nurse that's in our office that did a little session on food safety also. But basically, our new Americans were able to walk away with all of these household products that is just going to help them maintain a healthier environment at home. Earlier last spring, we had, again, with all the parents at the Refugee Assistance Program, we had sessions where we went over first aid kits and digital thermometers, and knowing how to read them correctly and when to use them. And so I just wanted to piggyback on what you do is like, a few years ago, I was able to receive a grant, and I thought, I think I need a nurse in my office. Even though I focus a lot on instruction, there's this other piece, the student support services piece that my department hasn't really focused on. So we hired a nurse, and I've been in this district for a long time, and I never knew that if you had a nurse in your department that could focus on your students and your families, that would help with attendance. Like, I didn't know that a child who had really some dental issues, that was going to keep them out of school for days and days and days. And I love the nurses at our buildings, but it's one nurse for 400, 500, 600 students. So my nurse was able to meet with the families, meet them at the dentist's office, make sure that there was language services that was provided, made sure that if there was needed a follow-up, that there would be, and made sure that they were able to get transportation to go to the appointment and to show up. So now I'm begging my district to keep that nurse position. The grant is going to be over soon, but I didn't realize how important that position was in our community. So, and she has reached out to all of the health centers, and I think they know that, you know, her name is Sharon St. Louis, and if Sharon's coming your way, she's going to be advocating for these students and families. So, and Sharon has helped us, you know, with all of these sessions with the Refugee Assistance Program. So, my focus is kindergarten, pre-K to 12th grade. And I believe the Refugee Assistance Program focuses on adult education.
Thank you. Noel, how do people know to find you? How do they get to Interfaith Works?
It is not about me. We are no, faith is not about me. But we already we have the intermediate. We have intermediate. Most of the people that we resettlement, they know us because we made like a good relationship with them, depending on their trust with us. For example, I have family. Whenever they want to go, please, can you come with us? No, I can't come with you. They say, no, because we are trust with you. They feel that interfaith is another family for them. So yeah, they can like contact with me. And we are available. We have our personal phone, we have our work phone, we have our emergency phone. So we are available for them 24 hours. You can say that. Yeah.
Leo, is that the correct pronunciation? Is there a challenge in medicine working with interpreters? Is there any training that needs to be done in terms of how both interact with each other?
Absolutely. So medical terminology is tough. And if you get a provider that just goes off on their medical terminology, like the interpreters could be as skilled as possible, but they're not also trained as medical practitioners, right? We have people that go to specific trainings for medical terminology and to be medical interpreters. But that is it's like becoming a doctor yourself. So they might as well just be a doctor. So we should pay them that way. So we have sometimes, I mean, I think in our clinic, our providers and all of our staff are really thoughtful about that. They know how to, for example, if I use a really complex term, I always say that means X, Y, Z. And that really helps kind of bridge that gap. But when it comes to other clinics, I'm hoping to eventually, so I've put together kind of like a cross-language and cross-cultural communication workshop that I've done in a couple spaces. And I'd like to be able to like expand that a little bit more and try to see if we could eventually work with other clinics. But this is just like a me back of the brain idea. So please don't tell my boss. But I would love to be able to work with more folks in different institutions to try to just learn how to more effectively use interpreters. And Lita, talked about that as well, spacing out what you're saying, right? I'm not going to give you the whole shebang, but sometimes I do. So the times that I do that is when I'm saying, okay, I have a big concept I need you to explain, and I know it's going to be really tough word by word. So I always talk to my interpreters and like, hey, I'm going to give you the whole shebang, and I'm going to trust you to explain it the proper way. So it's about like for us too is talking to interpreters and telling them exactly what you want. But there are times where I'm saying, I need this to be said exactly how I say it. I have some scripts in place. So those are the ones I take, phrase by phrase, and do that as well. But yes, the interpreters are really important, working with them in an effective way and setting them up to be successful. That's my job. My job isn't to expect them to just, grab the moon, but I have to make sure that they have the tools that they need. And I'm speaking in a way that is accessible for all people, and giving them the space to do that. And as well as I like to set my expectations. So I sometimes have had interpreters that maybe they've done the same thing. For example, we do green card clinic. So we have like a little script going, right? And so I have interpreters that sometimes will go off. But that, of course, it's excluding me from that space. And then maybe you're giving answers that isn't informed by what I'm saying, and that's the representation of me. So when it comes to working with interpreters, it's a trust relationship. But it is also about setting expectations of this is how, I expect you to be working with me, and this is what we do, because it is a job. And I try to do that with humility, because no human is a mouth. Like, that person is not going to be just a mouth that's going to do what I say, but I do need them to do the job in the way, because they are representing me in what I'm trying to say. So I try to create, good relationships with my interpreters, make friendly conversation. But it is very important when it comes to getting your message across in an effective way and treating them with respect and setting them up to be successful in the medical field.
How about either of you? Do you have any issues with interacting with interpreters? That
I think with my background as an ENL teacher and working with students and families, it just comes naturally. We do provide training to our staff, as silly as it is, like, how to use an interpreter wisely, and how to, make the best of your usage of your interpreter request. So that is a session that we focus on, and we just had a visit the other day at Northside Learning Center with our superintendent, and I think she needs to attend my training. She did really well, but there's a few things we could tweak, but she's trying. So, and I think any educator that's in Syracuse, you may have been a teacher in Syracuse, but eventually you're going to have these kids in your classroom. And we also provide lots of professional development opportunities for our staff. My department not only trains teachers, but we have provided training to nurses, transportation department, to our building leaders, because they have to manage, all the students in the building. So all different populations that you think we wouldn't have to, we do, because all these departments touch our kids. They see them every day. Even our custodians, just they're at the buildings helping us make sure that the buildings are clean and running well, but they, interact with our students also. So our family engagement department, even though their focus is family engagement, if you haven't had much experience with this population of families and students, you need that training also. So many parts, and that's where our department comes in and provides that training.
Great, thank you. So what are the language communities that are currently most underserved? Do any of you have thoughts on that? Noel?
Yeah, we have, it is not underserved or not served. No, we have like with Rohingya interpreters, we have like of Rohingya interpreters, because for the Rohingya, especially for the Rohingya language, there is no alphabet. They can't written. It is only oral. They can only interpret and no translation. So like if I have one interpreter, Rohingya interpreter, I have an appointment for 3 different family. I can't provide that for them. I should like reschedule for the other 2 family, and we provide just one for 1 family. So yeah, we have like with the Rohingya. This is in community, not for interfaith yet.
I know that Pular is a tough one for us. Yesterday we had like a little bit of a snafu around the Chin. There's so many dialects of Chin, and that we had gotten the wrong dialect of Chin. But again, like you just work with folks in a way and figure it out, and go through the list, and okay, this is the right one. Okay, we got it. Luckily we have the language line. And I know Sango had been a tough one for us as well, but we're lucky enough that we have a student that is gonna come on our staff that speaks Sango. But those are some of the languages that we found. We would have to like order somebody ahead of time and have them waiting for us on the language line. But and we like in-person folks as much as possible. But when they are more like dialectical, that's where it gets really tough, is when you're breaking up different dialects. And even with like Arabic, right? There's a million different dialects of Arabic. So if you have somebody that maybe that comes from a different part of Sudan, they won't understand this Egyptian person. So that I think is something really important to keep in mind, is dialects.
Does this lead you ever to using family members as interpreters? Do you find that children or teens? I know you've already mentioned, Lita, that you don't like to do it and you try not to, but I didn't know, does it ever happen?
From what it is.
Okay. Okay, makes sense.
No, for interfaith, we already informed even community partner to
Right.
not use the children, because if we use the children, it will be them under emotional stress and privacy and everything. So we already, why am I saying that? It's already, we encourage family from the first day they arrive to United States that it is not should use them as interpreter for them, because as interpret we provide the language service for them via the we have multilingual staff and we have language line, we have contracted training interpreter, so we have other sources.
Thank you. Lita, we were talking about this earlier, and I'm not sure I totally understand the question, but it relates to the science of reading. And there was a question, I'll read it. Language services can be enhanced through improved literacy instruction for English learners and emergent bilinguals based on findings from the scientific studies of reading. Can you speak to that at all?
So it's headquarters for the science of reading in Syracuse. And I'm happy to say that the New York State Education Department just came up with some briefs that directly addresses multilingual learners and English language learners. So whoever asked this question, I'm working closely with the State Education Department, and my team will be designing some professional development opportunities for our staff using these wonderful briefs. It's research-based, but with a big focus on language learners. So many times things are out there, they say it's great for kids, but there's not as much an emphasis on students learning a language and developing that language and becoming bilingual. So New York State Education Department has now come up with these wonderful briefs, great research behind it, and a great way to describe how it is a language learner learns a second language or a third language. So yeah, it just came out in November, and I'm looking forward to working on it with my team.
Okay. We had several questions on culture and building trust, and I know many of you have already addressed this, but is there anything we can go deeper on in terms of how language barriers intersect with trust barriers? I thought I saw you.
So language barrier and the trust barrier are closely connected, because most of new Americans were experienced and they came from system were unsafe and untrustworthy. So when they came here and couldn't find the language support, this is what led them to more confusion for them, maybe trauma, and isolated themselves, because the communication, it is very important for them to get connected with the community, to be more understanding for the new system for them, and even for us to build the trust with them. So when we will make them understand everything and all the documented and all the information they have, they will be more feel more respect and more understand. Yeah.
Anyone else on that one? Already covered. Okay. There was a question, are there either paid or volunteer opportunities available to help in this situation? Yeah, well, we'll take either, but usually mostly languages.
There's always, always interpreter positions available, but I know our clinic in particular, we're looking for a dentist. We've got a dental grant and we've been looking for a dentist that's interested in doing good work with our community. And I think all the other, and a PA.
We still have nationality worker positions that are out there, that our district would like to fill, but I know from HR that we highly encourage, bilingual staff, bilingual individuals to join our staff, just because they can communicate with our families and students. So anytime I've been in presenting in other communities, I always bring that up. Because we really need them. They're part of the community and we want them represented in the school district.
Certainly, we have opportunity for volunteer. They can contact with our development team with Jenny.
And talk a little bit more about the other organizations that you work with. I think, Leo, you've already talked a little bit about your partners. How about
We realized that during the pandemic that we were kind of working in silos. And so during the pandemic, we really got together with all the other agencies, RISE, Interfaith Works, Northside Learning Center, and tackling how we were going to serve our students. And it was powerful. And we've continued that. We meet bi-monthly and it's just nice to align, hey, we're going to have this type of program in the summer, but then they will align their program so that it doesn't conflict with us. So the students will benefit by attending both programs during the school year and in the summer. I personally am involved in New York State, some New York State organizations that advocate for multilingual students. And it ranges from getting the right teachers in place to supporting our families. And that's at the state level. And with their help, they've been able to bring some things to the surface, and it's been very supportive. And in our climate right now, you would think that it wouldn't be as active, but actually these fierce advocates are more active than ever.
So yeah, we have community partners who always support us, especially when Interfaith conduct culture education for them. Like we have partnered with Central. We already provide bus training for the New American, and we are connecting with the police department of Syracuse. Even they do courses regarding to women's rights, men's rights, and even police orientation in general, and police orientation for high school students. We have many partners, like for small business. We already did the small business, so we have a partner from them. We did Know Your Rights. We have partner. Yeah. Thank you.
okay, we're coming up against time. Are there any questions from the audience?
Questions for Leo, my dear friend. My favorite upstate hospital. Here's a question. Do you have any influence or do you educate your HR department about your needs, especially about bilingual, trilingual employees? You know that we may have medical professionals who just came or who are on way to get licenses and we're looking for a job, and obviously you can use them a lot. And if you have any influence that will help us on our side to place our candidates to work for a nice place in Syracuse. Thank you.
I got you on the spot.
Okay, I don't mind. Okay. Yes and no. So HR obviously goes over the entire upstate, right? So there's only so much they know about little peon me. But we definitely put it in our F1 or the FTEs, the job descriptions, let's put it that way, trying to be fancy here. And we put in, you know, preferred extra languages. We definitely like look for folks who have other languages. When we're looking over our resumes, that's really important. But when it comes to like, if you want to get put and funneled into our clinic, like I always recommend folks to be searching in the search bar, like Center for International Health. It's very clear when you're going to be working with us. But if somebody is, you know, so that's if somebody is, has a different profession and they're not an interpreter in particular. But when it comes to working with Upstate, we only have one person who's an actual Upstate interpreter that's full-time employed by Upstate. Everybody else is contracted through all these other different language services. So getting plugged in with those services is the best way as an interpreter to get into the medical interpreting field. But when it comes to people who are in the other professions that also happen to speak other languages, we definitely put it on our job descriptions. We definitely, you know, hope that people speak other languages or at least have cultural humility. And if you want to work for us, search Center for International Health. That's where we are. You'll find us. We're always trying to expand as much as possible, find new grants. So we'd love to always have, you know, folks coming into that space. Does that answer your question?
Great, thank you so much. And thank you, Leo, Noel, and Lita for being here today. Such rich information that you provided us. Very, very appreciative of all of that. Let's give them a round of applause. So as with all of our forums, we'll be posting this on our website shortly at focussyracuse.org. We're very grateful to those who've helped us keep Focus going with your donations and sponsorships. If you're so inclined, there's an easy way to donate at Focus on our website, or I think there's a little cash box out there too, and a donation of any amount is appreciated. Also want to thank the Community Foundation for allowing us to use this beautiful space. It's just, it's wonderful to be able to be here. Other than that, thank you very much. Have a great day. Have a great weekend. Thank you.